अभी तो बहुत थोड़ी सी लोग 84. Okay. Well, assalamu alaikum. Shall we start the class? Okay, today my topic is hepatic poisons, and you have heard about alcohol and alcoholism quite oftenly. Basically, we receive patient in our ER being brought by the police in odd hours, in early hours of day, and putting an allegation that the person has taken an alcohol. The patient has taken an alcohol. And this alcohol, it makes the person land into such a situation that the person, he becomes delirious, the person, he becomes drunken, he has a drunken gait, he had a slurred speech, he had a staggering gait, and his coordination is being disturbed. You being a doctor, on a request of police, you will examine a patient, and that is called examination of a drunkard. You will put a medical legal report. In a medical legal report, you will just examine the patient and declare whether the person is really drunken, or he has taken some other poison, or he has been given some other poison. Because there are so many other poisons like opium, morphine, codeine, pethidine, heroin, dynin, cocaine, dhatura, in which a person, or cannabis indica and its products like bhang, majun, ganja, hashish, when the person will be presenting in such a way that you will feel that he is drunk. Well, so you are going to examine that case, and first of all, you will examine by 3 lines. Number 1 is you will just put down the preliminary data. After the police letter, you will just put the preliminary data, and in which you will write his name and his sex and age, all the particulars about that particular person. And when you are examining the patient, and when you have started and when you have finished that. The consent of the individual, written consent is authenticated by the individual signature or thumbprint, but because the person is not in his senses, so it is not necessary. You will write 2 of the identification points, just like other medical legal reports, and you will take one from left side, one from right side to identify a person. You will write the name of the person who has brought that patient, his name, his bed number, etc., who has reported and who is a witness at that time. You will take the history that you will ask question from him. Maybe he will deny, maybe he will accept. You will ask him if he is suffering from any other disease, or you will ask him that are you on other medications as well, because the alcohol, it potentiates few effects of few of the drugs. So history will be taken. After that, second kind of examination is physical examination. Number 1 was the preliminary data. Number 2 is you will make a physical examination. Number 3 is a laboratory investigation. The physical examination, you will just write down the way he's presenting you, what type of clothes he is wearing, and the behavior of the person, what way he is, has presented you, depending on the stages. There are different stages, and the signs symptoms, they appear in a patient depending on the blood saturation, or maybe it is 10 milligram per 100 ml, whether it is 50 milligram per 100 ml, whether it is 100 milligram per 100 ml, maybe 300 milligram of alcohol is there in the saturation, maybe 350 to 450 is there, maybe 450 to 500 is there. The fatal dose is 450 to 500 is the fatal dose in which the person will land into comatose state and he will go into coma, and at that time you will just make a DD of a coma. You know, the patient lands into a coma for different reasons, like maybe hypoglycemic coma, maybe hyperglycemic coma, maybe uremic coma, maybe malarial coma, maybe latent encephalopathy, maybe uremic coma, maybe it is alcoholic coma, maybe it is because of the opium and its alkaloids. You have to make a DD of coma and to make clear that the person has taken an alcohol. Without wasting more time, I will, because it's a long topic, of a person who has taken an alcohol, obviously he's in a comatose state, his pupil will be dilated. The smell of alcohol will be coming from the mouth. You will find that the person, he is having a dilated pupil, and we say the dilated pupil is a sign of death. But when you pinch a pinna or you give a strong stimuli, it will come to the normal size, and again it will go to the dilatation. This is called a McEwan sign. The smell of alcohol is coming from the mouth. You will take the blood, sent for the analysis. You will find that the level of alcohol in a non-alcoholic or alcoholic will be like 350 to 450 milligram per 100 ml. You confirm that respiration is there, pulse is there, and pupil is giving reaction, and McEwan sign is positive, and the level of alcohol in the blood will confirm you that this is an alcohol poisoning. But before that, in a physical examination, when we are examining a patient, he is having a slurred speech, he's having a staggering gait, he is having tremors, and he is using abusive language. Either he is hyperexcited, either he is going toward narcosis, depending on the stages, which we will talk about. You will look at the general appearance, his disarranged clothes, or his behavior, or his attitude and speech will be slurred, and you will ask him to sign on a piece of paper, and you will match it with the CNIC or maybe license in other parts of the world. He won't be able to sign properly, his memory and mental status, and then after that, you will look at his gait, whether the gait is normal or he is having a staggering gait like other poisons. I gave you an idea about Dhatura and cocaine and cannabis indica product, opium and alcohol. All these road poisons, they give same kind of, So gait, you will ask him to walk on a straight line. He will not be able to walk on a straight line. His manner of walking, his turning up, etc. You will look for the vital data. Then you will note the odor of alcohol from the mouth. You will ask this person you will just try to look for the reflexes. And the reflexes is you will ask the person to just touch his nose. He won't be able to touch it. This is called finger nose test. You will ask him to button his clothes. He won't be able to button his clothes because of the fine movement will be lost. You will ask him to pick up a coin from the ground. He won't be, because he will be having a diplopia. He won't be able to pick up the coin from the ground because of the incoordination. This is called coin test. You will make a straight line and you ask him to walk on a straight line. He will not be able to walk on a straight line. He will be having a staggering gait, etc. This is called Calibra's test. And these are the tests you will be performing for the coordination and to look for the reflexes. Then after that, all these reflexes will be delayed and the coordination is impaired, and the person will not be able to answer you properly, and he will be taking time for that, because the alcohol, it delays the reaction time. There are few unusual type of actions. Sorry. So there will be unusual actions will be there, like the person will be nauseating, or he will be vomiting, and he will be having hiccups, and he will be either getting agitated or irritated, or maybe he will be using abusive language. The smell of alcohol is coming from the breath, and the loss of self-control, and clothes are arranged, and the dilated pupils are there. He will be having some kind of diplopia and slurred or incoherent speech will be there. Gait will be unsteady, etc., etc. These are few. Then you will be going for the third kind of a test, that is, you will, after preliminary data, then you will look for the spatial features like signature, smell, pupil, etc. Then you will ask him to sign, and after that you will just go for reflexes. Number 3 will be the laboratory investigation. You take the blood, you will take the urine, you will take the breath. And in this part of the world, we don't have the drunkometer. So we just put bichromate crystals in the bag, and we ask the person to blow in the bag. These bichromate crystals, they will turn to green in color. That means the fatal level of alcohol is there. You will ask the patient to pass urine in a bottle, and he will pass urine. You will send attendant with him in the washroom, and he will pass urine, and you will just mix phenyl mercuric nitrite in that, and you just shake it and keep it for sending for the chemical analysis. Then we have a blood. You will take the blood from the periphery, and depending how much time has passed, you will take the blood. Your attendant will take the blood without cleaning with the spirit soap. He will just clean it with the soap solution, because it will disturb the level. You will take the blood by cleaning with the soap solution, and the blood will be taken, and you will put this in a pipette, and you will mix sodium fluoride in it, and just shake it, and put a cork over it, keep it in a fridge for sending for the analysis. This is the blood you are taking, and syringe will be free from the traces of alcohol and any other chemicals, and you will take the sample, and you mix with the sodium fluoride in this. This basically, these inebriant poisons, these vitreous fluids can be taken also. In case of dead body, you take the CSF as well, and otherwise in a live person, you are taking blood, urine, and the breath. This is urine you are taking. Now, going back, that the person, he has 7 stages. There are 7 stages of intoxications, and depending on the level of or the amount of alcohol he has taken, either he will go directly into the stage of incoordination. If he takes small doses, he will be having a stimulation, and basically ethyl alcohol and methyl alcohol, these are the 2 types of alcohol. This ethyl alcohol is more commonly being used, and ethanol is a CNS depressant basically. And initially there is a suppression of inhibitory neurons causing paradoxical CNS stimulation. And ethanol depresses primarily the reticular activating system. The frontal lobes are sensitive to low concentration. resulting in the mood changes, and is followed by the occipital lobe, that is the visual disturbances will be there, or the changes will be there, and ultimately the cerebrum will be involved and the loss of coordination will be there. These alcohols, there are several types of alcohols, but the most important one for the clinical point of view or a forensic point of view is ethanol. And the ethanol, we'll talk about the science symptom. This alcohol beverages basically based on the alcohol used by the offender, and there are two types of alcohols, and these two types of alcohol, the alcohol is being used as a beverage. Alcohol beverage is potable liquid, 2% to 75% of the liquor concentration is there. They are being made by two ways. One is by fermentation, one by distillation. In fermentation, the yeast is being added and it is being fermented. The juices of the different fruits, they are being fermented. And as the name suggests, the distillation process will be followed. And rum, whiskey, brandy will be distilled type of products, and the beer and the wines will be fermented type of products. I told you, ethanol is the most important one, which is for a forensic point of view. And because of these actions, basically it is a depressant. But because initially there is a suppression of inhibitory neurons and making paradoxal sinus stimulation, the person will be excited initially, and lately the ethanol depresses the reticular activating system, the frontal lobes, the occipital lobes, they will be involved later on, and they will give the control. This ethanol is rapidly being absorbed from the GI tract, 80% from the small intestine and 20% from the stomach, and the rate all depends on the contents or the stomach contents, whether there are contents. So if the contents are there, then 20% of the ingested alcohol may never be absorbed and does not therefore appear in the blood. So absorption is rapid when the concentration of alcohol is not very high, and when the stomach is empty. There are three ways in which alcohol is metabolized in the body. There's some disturbance at the back. Sorry for that. Alcohol, basically, alcohol dehydrogenase pathway. There are three ways by which this alcohol is going to metabolize in the body through the liver. And number one, alcohol dehydrogenase pathway. Alcohol is metabolized first to acetaldehyde and acetic acid, and then to carbon dioxide in the water ultimately. Number two is microsomal ethanol oxidizing system. Then is the peroxide catalase system. The first is the major pathway in which the excretion is mainly through the kidneys, and alcohol percentage falls at a rate of 10 to 20 milligram per hour. When the rate of drinking exceeds this, the signs of intoxication appears. And there are 7 stages you will find in a case of an alcoholic. The intoxicating effects of alcohol beverage is mainly due to alcohol, but it's also contributed because of the other substances present inside, that is the aldehydes, ketones, and the ethers and the essential oils. These are the things which are going to make an intoxication. There are 7 stages altogether. When the person, he takes an alcohol, he takes a little amount of alcohol, 1 pack, then stage of sobriety will be there, or the person will be behaving in a decent manner. There will be no appreciable sign symptoms, and that level of alcohol in the blood will be 10 to 50 milligram per 100 ml, and in which a person will be behaving in a normal manner. Hardly you will be able to diagnose them. Number 2, the person, when he will take more than that, 50 to 100 milligram will be there, the person will be in a euphoric stage and he will be delighted, excited, and talkative, more confident, and feeling of well-being, talkativeness, increased self-confidence, lack of inhibitions will be there. And the person, he has taken a bit larger dose, 50 to 100 milligram. Stage of excitement, when the 100 to 150 milligram will be there, the person will take, after the hyperexcitation, he will be having emotional instability, increase in reaction time, mild muscular incoordination will be there, like a person who, sorry, who reports to the office, or maybe comes in a party, and if he is a bit out of his mind, so people, they diagnose him, he must be drunk. Like few of the patients who report to us, and if they behave in a different manner and unusually talking in a different manner, we just decide that he is under the influence of alcohol or something, and the smell of alcohol is coming from his mouth, and that is 100 to 150 milligram will be there, and the person will be bit unstable. Number 4 stage of confusion will be there, when the alcohol level will be 150 to 200 milligram, depending whether if he is habitual alcoholic, then you will find that in 150 to 200 milligram, disorientation will be there, mental confusion will be there. You will find that the person will be having a slurred speech, he will be having, misbehaving or using abusive language, muscular incoordination will be there, etc., etc., when the level is 150 to 200 milligram. In stage 5, stage of super will be there, and in which the person will be behaving like a stupid, and the level is more than 200 milligram, is up to 300 milligram. You will find that he will be having a inability to stand or walk properly. He will be vomiting constantly, and the loss of consciousness or semi-conscious state will be there, etc., etc. In 6th stage, it is like 300 to 500 milligram, but basically the person will be in a non-addict, non-alcoholic. He will be having 350 to 450. He will land into comatose state, and in a person who's habitual and who's chronic addict, he will go into directly into coma, or he will slip down and he will be in a bad posture. He will go into coma in when the level is 400 to 500 milligram per 100 ml. So blood alcohol is 350 to 450. When deep unconsciousness will be there, there will be abolished reflexes. You will find that the person will be having a labored breath. He has been brought to you in a comatose state in an ER, and you will be making a DD of alcohol for that. The 7th stage is when the level of alcohol in a non-alcoholic will be 400 to 500, or maybe in a addict it is 450 to 500 milligram. The blood alcohol level will be high, and the death will be because of the respiratory depression. And though all 7 stages of alcohol intoxication are distinct in order, perceptible in the breath of the individual, the bad smell will be coming from the mouth. And there are, different products. It is interesting to note that even after a person has completely absorbed the effect of alcohol, the odor may persist in breath for a considerable period of time. When you go for a postmortem, external features will be there, internal features will be there. Externally, you will find people will be dilated, and the smell of alcohol is coming from the mouth. And when you enter inside, you will find all alcoholic smell is coming from the system, which rather been found congested, etc., etc. So before that, what you do is that there was one of the scientists who was called as a Widmark. Who was Widmark, and what is his equation? He gave a very, good kind of formula to assess how much alcohol is there in the blood. Basically, we depend on signs, symptoms. Signs, what he can tell you, signs, what you can see, symptoms, what he mentions you. And you will look for the clinical features, and after clinical features, you have diagnosed that it is alcohol. You will go for reflexes, and after that, you will go for laboratory investigations. And in laboratory investigation, whether it is a snake bite, whether it is a case of any other poison, you get a phone call report. And just like these days, you are getting a report for this COVID and Corona on telephone or on online. So same way you will get a phone call, this much of the alcohol, level of alcohol is there in the blood, etc. So, but one of the scientists, Widmark, was a Swedish researcher, and he was a pioneer in researching ethanol, and he has worked a lot on alcohol. His work has remained very influential in forensic alcohol analysis. This scientist, he researched how ethanol behaves in the body. He studied how after consumption, ethanol is being absorbed, distributed, eliminated. His work helped to show the level of alcohol in the body from consumption to elimination based on certain factors. He gave us a formula. He said that the blood alcohol level, which comes in ounces, multiplied by constant for a male 3.75 and for female it is 4.7. That is the elimination rate will be 0.017, and the time in hours over the total weight of the person. You will just calculate. You will get how many ounces he has consumed. And this is Widmark's formula. Again, that Widmark formula states that one blood alcohol content is equal to number of ounces of alcohol consumed multiplied by the constant. For a man is a 3.75 or for a female is 4.7, and divided by person's weight in order to determine blood alcohol concentration at different time intervals. He chooses a constant rate of elimination B, that is 0.017, and the time T. So the formula is given below, and you will calculate that how much alcohol has been consumed. The alcohol we were talking about, postmortem findings are there? No. Okay, when the person has gone into coma, later he died because of the respiratory failure. And when he has died because of respiratory, you take him to mortuary. External, internal findings will be there. Always you mention external finding and internal finding. And all the viscera will be full of alcoholic smell, will be having a congestion, and etc., etc. But before that, if you want to save the person, you will just go for the treatment. And the treatment, the first time the person who has taken this alcohol, you will go for maintaining the IV line. Then you will use activated charcoal in usual dose, some and thymine 100 milligram intravenous will be given. And stomach wash is not useful if done more than after 3-4 hours after alcohol ingestion. Over here it is written 2. But when the patient reports to us after 4 hours, we never do stomach wash for all other poisons as well. Excuse me. So you will maintain IV line, and you will go for stomach wash, and you will give this activated charcoal, that is the antidote, and the thymine 100 milligram will be given. If the person is a chronic addict, and the person he aims to gradually withdraw the poison, that is he want to go for a withdrawal, he has kept on taking the drug, and he has developed tolerance, and slowly, gradually he has increased the dose. And obviously he is taking large dose, and he will not go into a stage of excitement. He will not go into a stage of incoordination. Maybe he will go into a stage of, narcosis, or maybe he will be in taking larger dose. So chronic poisoning, the aim is to gradually withdraw the alcohol until finally the patient can manage a normal life on his own. So without the support of alcohol, because all the drugs of addiction, to maintain the normal life, the person has to keep on taking the dose of the drug on intervals, and he need to take the drug to maintain his normal life. This person who is an alcoholic, he want to leave the drug. So there is, you know, in intake, everybody stop in chronic alcoholic will produce severe kind of withdrawal symptoms, which I will tell you just now. And the addiction must be undertaken in the hospital over a period of several days under close medication. And since there is often unstable craving of alcohol, so you are going to give him disulfiram, and many methods are there. You are giving anti-abuse therapy, you are giving disulfiram being given, and one of the more successful ways is administer a drug called disulfiram. This inhibits the oxidation of acetaldehyde to acetic acid metabolite of ethanol, because it is going to break the alcohol, and it is going to, but this disulfiram is going to block the, it is going to block the breakdown, inhibiting oxidation of acetaldehyde to acetic acid, a metabolite of ethanol, resulting in accumulation of this alcohol and produce unpleasant symptoms like a flushing, headache, palpitation, nausea, vomiting, vertigo, or hypotension, etc. So when the person, he will take an alcohol and he is on that medication, and because of phobia, because of those signs symptoms, he will stop taking that drug slowly, gradually. So some investigators believe that these symptoms are actually produced by metabolite of disulfiram, but carbon disulfide, and not by acetaldehyde. But whenever the mechanism, the patient avoids intake of alcohol as long as he is on disulfiram. So doctor has prescribed him disulfiram, and if he will feel that I better take an alcohol at the same time, little bit, so it will not be broken, it will not be oxidized from acetaldehyde to acetic acid. So it will remain in the blood. So person will have these kind of sign symptoms like a vomiting or abdominal pain or chest pain, etc. So he will feel uncomfortable, and he will avoid taking the. When you will withdraw the drug, there are different kind of symptoms you will feel over the patient, especially chronic addicts, that maybe in chronic alcoholic, when alcohol is suddenly withdrawal, 6 to 8 hours later, there is nausea, abdominal cramps, insomnia, headache will be there. And if the person after that he is not being given or he have not received, then after 24 to 36 hours, no need to memorize the hours, but there are delusions, hallucination, auditory hallucinations will be there, and the person will have some kind of a fits, etc. And tonic-clonic convulsions will be there, or body movements will be there, and maybe person will be conscious or maybe semi-conscious at that time. There is one of the terms which comes in a BCQ, that is delirium tremens, usually develops after few couple of days time, and it is characterized by the confusion, delusion, hallucination, agitation, and the person will be having hypertension, and maybe the person, he is behaving in such a manner that you feel that he has become psycho. But these are because of the withdrawal symptoms, and you have withdrawal at once, and maybe the person will be showing you them. Then we have a few other symptoms been appearing. This alcohol, basically, it reacts with few of the drugs, and it has an interaction with few of the drugs. You have to be very conscious that you will not give medicines, or you will ask the patient whether he is on an alcohol before going through surgery, etc. So alcohol and has a interaction with few of the drugs. It has a potentiating effect with few of the drugs. So anesthetics are administered prior to surgery to render a patient unconscious and insensitive to pain. So chronic alcoholics consumption increases the dose of the propofol. You have to give more and more. And when he is not getting sedated or he's not going under anesthesia, maybe the anesthetist will become anxious and he will feel that maybe he is on some drug or something. Chronic alcohol consumption increases the risk of liver damage that may be caused by the anesthetic gases, or maybe food chain. And another drug, that is the warfarin, we are being prescribing to retard the blood ability to clot. Acute alcoholic consumption enhances warfarin ability, increasing the patient risk for life-threatening hemorrhagic conditions like chronic alcoholic consumption reduces warfarin ability and lessening the patient protection from the consequences of the blood clotting disorders. Maybe at that time, because he was on a drug, and when we have given a warfarin, Coumadin, it comes with the name of Coumadin, it will decrease the ability of blood to coagulate. He will start having the hemorrhagic disorders. Alcohol and depression is frequently associated, leading to high potential alcohol and antidepressant interaction. Alcohol increases the sedative effect of tricyclic antidepressants such as amitriptyline, and impairing mental skills required for driving. So when you give this kind of a drug, maybe you will advise the patient not to drive the car, and it produces depression. The painkillers are being given. These are the drugs which are being given for moderate to severe pain. They include the opioids, morphine, codeine, pethidine, heroin, and all these drugs. They are potent painkillers, and maybe mepridine. The combination of opioid and alcohol enhances the sedative effect of the both substances, increasing the risk of death from overdosage. A single dose of alcohol can increase the ability of potentially increasing its sedative effect. So it potentiates each other's effects, and maybe the person will go into sedation or depression. Then we have a narcotic pain relievers. Aspirin is also being taken by the people like on a low dose as keeping the for antiplatelet aggregation activity. Aspirin and similar non-prescribed pain relievers are most commonly used by the elderly. Some of these drugs can cause the stomach bleeding and inhibit blood from clotting. Alcohol can exacerbate these effects. Older persons who mix alcohol beverage with large doses of aspirin to self-medication for pain, and therefore are particular high risk for episodes, and it disturbs the gastric mucosal barrier and will make a gastric bleeding. In addition, the aspirin may increase the ability of alcohol, highlighting the effect of a given dose of alcohol. Then we have a sleeping preparation. We never prescribe these sleeping preparations with the alcohol because of the potentiating effect. Benzodiazepines such as Valium are generally prescribed to treat anxiety and insomnia. Because of their great safety margin, they are largely replaced by the barbiturate, now used mostly in emergency treatment of convulsion. The benzodiazepine or lorazepam, which is coming with the name of Ativan, is being increasingly used for anti-anxiety and sedative effect. The combination of alcohol and lorazepam may result in depressed heart and breathing function. Therefore, lorazepam should not be administered to intoxicated patients because it will make a potentiating effect for them. Right? This acute alcohol consumption increases the ability of barbiturates, increases the availability of barbiturate, prolong their sedative effect. Chronic alcohol consumption decreases barbiturate ability through enzyme activation. In addition to acute and chronic alcohol consumption, enhances the sedative effect. Barbiturates and their site of action in brain, sometimes leading to coma and fatal respiratory depression. The patient is going to die from respiratory failure because it will depress the respiratory system, because it potentiates the effect of all these. There is a ethyl alcohol, and we have a methyl alcohol which is called a kachi sharab. This methyl alcohol, it is being used in industry, and it is methylated spirit, or it is used mainly in the industry. It is a cheap and freely available. These are used as a methyl alcohol is a denaturating of ethyl alcohol, though it is not intended for ingestion. Yes, many people misuse it in spite of its toxicity. It is one of the drugs which make the optic atrophy, and the person will have optic neuritis, and optic atrophy will be there, and the person will develop blindness from this kachi sharab. And this methyl alcohol, which is being used in the factories, and it is being metabolized in the body. Slowly, 80% is eliminated out through the lungs, and rest of the thing is being excreted from the urine. The symptoms after ingestion vary accordingly amount. People gets dilated, marked depression, depression of respiration, causing cyanosis, and prolonged use is associated with the optic atrophy, as I said, which produce some residual blindness. The blindness may clear up temporarily, only to become permanent a little later, but it makes the optic neuritis or optic atrophy, and blindness is the most important feature in this. Death is usually from the respiratory depression. Most deaths are due to alcoholic coma or inhalation of the stomach contents. Postmortem findings are non-specific except for visual congestion, smell of alcohol, and cyanosis, blood and urine collection during autopsy contain formic acid and formaldehyde. So this is methyl alcohol. Basically, it's a very long topic. There's inebriant pauses. They are very long, but we got only one lecture. And to go through today, I was supposed to take only the signs, symptoms in detail, but I have made it in a points. So these are the 7 stages of alcohol intoxication, and depending on the saturation in the blood, these 7 stages of intoxication progressively go up to comatose state, and the person will die because of that. Maybe a non-alcoholic or an alcoholic, there is a variation for 50 to 100 milligram for a chronic addict, and maybe a person who was taken for acute poisoning for the first time. And there are, intoxicating effects of alcohol, mainly due to alcohol, and is contributed by the few other things like ketones, ether, aldehyde, and essential oil. Saturation depends on 0 to 50, and 50 to 100, and 100 to 150, and 150 to 200 milligram, and 200 to 300 milligram, and stage of comatose like maybe 350 to 450, and the death will be confirmed at 500 milligram per 100 ml. The person will go into comatose state, and later on he will go into death, and this will be depending on the saturation. The ethanol is a CNS depressant basically, and initially there is a suppression of inhibitory neuron causing paradoxal CNS stimulation. When it will depress this neurons causing the CNS stimulation, later on the ethanol depresses primarily the reticular activating system. The frontal lobes are sensitive to low concentration, so mixed type of signs symptoms will be there, like maybe resulting in the mood changes because of the frontal lobe involvement. But then there will be occipital lobe will be involved, and visual disturbances will be there, and then the cerebrum will be involved, and that will produce a loss of coordination. There are different type of alcohols. I told you that the alcohol is of 2 types. One is fermented one, and another is distilled one. The juices are being introduced with the yeast and been left for some time for fermentation, and maybe beers and wines are there, and distillation process will be for rum, whiskey, brandy. These are different products. Basically, the alcohol consumption will make the person learn into crime, and there is a relation between an alcohol and a crime, including the person will be having a behavioral changes. He will have a, different attitude changes will be there, including domestic abuse, violence, when he will be taking this drug or alcohol. He will be landing into a situation like he will go for a robbery, or he will go for assault, sexual assault. Like 5.3 million adults of were drinking at the time of their conviction or at the time of crime. Alcohol is a factor in 40% of the violences. About 3 million violent crimes occur each year in which a victim perceives the offender has been taking drugs, or he was drinking, and he will get involved in different crimes like maybe rape, sexual assault, robbery, or grave simple assault cases. About 2/3 of the violent crimes are characterized by a simple assault. Based on the victim report all over the world, alcohol consumption will make the person agitated, hyperexcited, and 37% of the cases, rape and sexual cases, assault cases, in which the person accused has taken alcohol. 50% of the robbery, before robbery, he has taken the alcohol, and 27% aggravated assault and 25% simple assault cases. So in other cases also, in this part of the world, when a person, he takes a drug, when he is going for a robbery, or he is going for a bank robbery, or maybe on a petrol stations, or these places, they take the drug. And when they take the drug, they are in a hyper-excited mood. They are in a more confident. And that is the reason when they go over there, when they get a resistance, they just kill the person and they run away. And before going for this job, they usually take the drug. So this is about the alcohol. Questions open again. Okay. This is about something about alcohol, ethyl alcohol and methyl alcohol. And ethyl alcohol, obviously you have to treat the patient later on after you will examine the patient. This is not your only duty to just put down your observations and decide when you get a report from the laboratory to decide that level of alcohol was nearly 200 to 300 milligram per 100 ml of the blood. You will no doubt, you will just go by ml report. You will just cut down the ml report. You will just write the preliminary data. Then you will look for the special features. Then you will go for the reflexes. And number 3, then you will go for a laboratory investigation. And after that, you will ask the ER, in charge, and the nurses to treat the patient. And treatment, obviously, you will go for a stomach wash, and you will start treating the patient. This is what you have to make the DD of the comatose state. And I told you there are few medical conditions, there are few toxicological states, and we are bothered about more the forensic or toxicological state, like maybe he's in a coma for a head injury. The injury will be there on the head on one side, and maybe counter-coup fracture will be there, maybe injury will be there on the head. You will go for a CT scan. CT scan will give you an idea. Primary, secondary run over injuries will be there over the body. So because of the accident, because of the fall, because of this reason, the person is in a comatose state, maybe unilateral pinpoint pupil will be there. And in case of opium and its alkaloid, morphine, codeine, pethidine, heroin, dynin, you will find that the pupil will be pinpoint, and you will find that the body is moist, just like he has taken a bath. He will be perspiring from all sides, and the person will be, and level of opium will be there, and typical musty smell of opium will be coming from the mouth. I'm not talking about a hypoglycemic state or a hyperglycemic state, or maybe uremic coma, or maybe I'm talking about only forensic states. And in case of this toxicology, you will find that in case of an alcohol, pupil is dilated, the smell of alcohol is coming from the mouth, and pulse, respiration, everything is there. And you will find pupil is dilated. You will pinch the pinna, you give a strong stimuli, the pupil come to the normal size, goes back. This is called McEwan sign, which is a diagnostic tool for the diagnosing alcohol poisoning. So this is a GD of a coma you will make, and later on there are a few drugs which potentiate the effects with the alcohol. So you take the proper history, you will avoid giving those medicines, or you just discourage the patient for taking those medicines. And then we have one of the formula which was given by the Widmark, and that is to calculate. This is about alcohol. Main thing is you should know that how it is being acting, and what are the signs, symptoms, and depending on the saturation of the alcohol, what signs, symptoms can arise. This is what we. So, any question? Any question? All over the world, even this is a Muslim country, quite many people, they report to us with a history of alcohol consumption, and acute poisoning cases. They report to us in an emergency who has taken a bit larger dose, and there are many people who report to us like this. And secondly, the chronic addict, they give a history. The doctor, we are taking the such and such drug, etc., etc. So there are so many all over the world. They are being involved in crimes because of under the influence of alcohol, and rape, assault, robbery, and all these assaults. Domestic or maybe street crime there because of when the person is in a and under the influence of alcohol. Then this is ethanol is seen as depressant, and initially suppression of inhibitory neurons, causing paradoxical CNS stimulation in the beginning. Ethanol depresses reticular activating system, frontal lobes. Later on, frontal lobes are being involved. They are sensitive to low concentration, results in this mood or behavioral changes, and followed by occipital lobe and the visual disturbances, and then the cerebrum will be involved. Lot coordination will be there. This is about the alcohol, and 80% is being absorbed from the spontaneous, and the rest is being absorbed for sperm, depending on stomach contents are there. And there are three ways in which alcohol is being absorbed. Number one, alcohol dehydrogenase pathway. Alcohol is being metabolized, gone through the liver, being metabolized to acetaldehyde, then into acetic acid, then to carbon dioxide, then to water. Second is microsomal ethanol oxidizing system, then is peroxidized catalase system. But the first one is the major pathway. The first Excretion is mainly through the kidneys and it evaporates through the lung because it's a volatile substance, etc., etc. Then acute poisoning, there are 7 stages. It is because of the intoxicating effect, is because of alcohol, and it's contributed by other substances as essential oils, ethers, ketones, aldehydes, etc. These are the stages. And when the person will be will be confident, there will be no appreciable sign symptom, then person will be second stage, hilarious, excited, confident. Third stage, person will be going into incoordination, etc., etc. Lately, ultimately, will go into comatose state, and then he will die. Yeah, but why the questions are not appearing? Any question? Any question? Attendance is very short. Any question? I appreciate if you submit your assignment on time, because the time which we have given you, we stop taking assignment after that. And for internal evaluation, you know very well that it is very necessary. We go through with your assignment. We just discourage cut paste, and you have to read and you have to reproduce that with the references, with the photographs, and the according to the specifications we have given you. So you better submit at the earliest, so we can go through nicely. And all the teachers, they are sitting and they are reading your assignments and you the markings for that, and that is very important. And few of the students who have not submitted, so I can't help you out for that, because the internal evaluation column, it will be all empty, and it will be difficult for you to recover from that, right? So I appreciate if you submit your assignment on time. We will be floating a next assignment, inshallah. I think we are, you better write on my email address, that is mukarram.ali. And when you are getting my emails, everybody is getting my email. And now after so many classes, you are writing me that I haven't got email for assignment. Anyway, we will note down and we will send you again, right? Any question up to this mark? Any question about drug of addiction? Any question about throat poisons? Any question about the drugs and the drugs of addiction? Basically, we are floating our assignment for the DOM medical college students only, and we are not giving to IMC students. And the IMC student, their faculty will give the assignment, or other type of assessment will be done over there. This is only for DOM. I'm sorry, what to do? This is online. You must have seen the online lecture on a WhatsApp. The people, they make fun of it. Obviously, out of my 500 students, 550 students, 200 students are online at this time. And this is what we get, roster, and we go according to that. But these assignments are only for the DMC students, and they have to submit online. Thank you very much. Any other question? Next teacher is waiting for me, because I got late by 5 minutes. Now other teacher is waiting for me. Any other question? Thank you very much.